Some of you may want to know how we're governed, how we're funded, what's it look like. We have an 11-person board that is appointed by the District Health Advisory Council. The District Health Advisory Council is basically a collection of all the cities, villages, and townships within Wayne County. So we meet at least once a year in March to determine, with the primary responsibility of appointing a new board member or reappointing a current board member. We do have 2 representatives that have to represent the city of Wooster, one from the city of Richmond, and one from the city of Oroville. The other 7 are from the balance of the county. The Ohio Revised Code does require we have 1 physician on that board, and then the other has to be a district licensing council member, which is basically a regulated entity. So somebody that we regulate. Currently a food operator is in that district licensing council role of our board as well. Our budget is approximately $3 million. A majority of that is fees that we collect either from our environmental programs, our clinics that we do, also birth and death certificates. That's a vast majority of that, plumbing fees. And then we have just under 20% we actually get from local tax dollars, from local millage, from counties, villages, and cities. We don't receive funding per se from the county government, although they do provide us the building on Walnut Street down from the library is owned by the commissioners. They do not charge us rent. So we're certainly appreciative of that. And my environmental unit is actually housed in the county administration building. So, and then 18% of our funding is state grants. Most of that is actually federal pass-through dollars. So our WIC program, for example, is a state grant. To fund our emergency preparedness activities is also a state grant. That's a federal pass-through. And then we do have another one where we provided, which I didn't even, that was again not listed on that bulleted list of our patient care and what our nurses do. They actually will go out and do some education and training to local healthcare providers on the immunization schedule, both at the 0 to 2 age and also kind of the newer preteen, teenage, and even high school vaccination requirements. And then we also get a little bit of money from the state general revenue, not very much, but nonetheless, certainly appreciate it and certainly helps us in our mission. Go ahead, Kim, I'm sorry. Now, probably the bigger reason I can appreciate why having me here today. But just to kind of give you a kind of a timeline, and obviously some of this, as you see, we'll go to the next couple slides. They may have started early, but we're still working on a lot of these things. In terms of preparation, when we first started to get more communication from the State Department of Health and we started to see cases in other parts of the country, obviously we felt the need to do some increased community awareness. So our emergency preparedness coordinator had sent out a lot of situational updates to community, primarily healthcare providers, first responders, schools, those kind of entities that obviously see a lot of folks. And then we decided like mid to late February to start to convene some of those stakeholders, some of those folks that we provided those updates to give them some guidance on how to respond to these things. So we had a meeting of kind of the initial incident responders in late January where we had hospital systems, we had fire, EMS, we had county commissioner, just to kind of say, hey, this thing's going to be coming. We need to really be prepared for it. We also did one with the school superintendents. This one was this was before they closed the schools down. So it was the guidance that we were given at the time to give, to how to make those school buildings safe, which kind of became a moot point once they closed them all in terms of keeping the students and the faculty and the staff safe. We also knew that there was going to be a key business component to this. We had not quite realized there would be a stay-at-home order at this point in time. But again, we just had given our chambers, all 3 of our chambers of commerce, some updated guidance for businesses to use so that they could share with their membership. And then we did one for the nursing homes. As you can imagine, a lot of it was CDC and ODH guidance, going through it with them, to things that they can do to help prevent from getting some of their residents sick. Although you can imagine that that is a tall task to do that. One of the other things is we started to even see some cases within our own state, and you're going to see. Joe Villegas will be here next week, so I don't want to steal too much of his thunder, but I do want to point out that we worked with EMA to establish what's called a joint information center, which is basically a one-stop shop for getting the information out to the folks that really need it. We also collaborated with the United Way to utilize the wire as kind of a call center. As you can imagine, as this started to first roll out, it would be overwhelming to us as an agency to field all those calls. And even though there was a state call number, which still exists, obviously folks that are local want to hear, locally, they have questions, they would rather talk to somebody locally, which is completely understandable. So the United Way volunteered, stepped up right away to offer that, to do that call center locally. So a lot of times what will happen is we have a script from the Ohio Department of Health that gets updated usually 3-4 times a week. We provide that to the United Way as it gets updated. If the questions are very specific to either a medical situation, or if they're specific to the stay-at-home order that they don't feel comfortable answering, they can certainly forward that to us, and they have, and we handle those as well. If you go to, there's a website, wcjic.org, is kind of a convenient place to go to. It has information from the local health department, from us, from the State Department of Health, from the CDC, some informational videos on there, just to talk a little bit of that speak to the to the issue, especially as we have it here locally. We've also established emergency operations center calls for awareness for various community partners, and we were actually doing these more than weekly, but now we've shifted, and because we're kind of, and I hate to say that we're in cruise control because we're still getting some cases, but nonetheless we've gotten to a point where the response is pretty well like a well-oiled machine. So we have 2 calls that I'm on. One is a weekly responder call, which is really, as you see there, the hospitals, fire, EMS, police departments, the dispatch centers, as well as United Way, to really hone in on that response in terms of understanding cases, any issues that any of those entities are having. If there's certainly some way that the health department can help them achieve their missions, and obviously, and then if we need to seek additional guidance, we work together. And then certainly if I need to go to the state level, or our EMA needs to go to their state partners to get additional guidance, we certainly will do that. And then we do a weekly kind of more of a community partner call. This is where I was speaking about those collaborations that we have in the community. A lot of our social service agencies, of course, we offer all the weekly responders to jump in on those calls as well. The nursing homes, mental health, other healthcare facilities, elected officials, and I know I'm not including it. I'm sure I'm missing some folks on there, but with those calls, we look at dealing with other things with respect to attacking this particular incident. One of the things we're working on now is homeless, and what to do if a homeless person is COVID positive. So working with some of the agencies that typically work with the homeless on trying to utilize the guidance that's given to us by the state, but also to not only keep those folks in a place where they could be safe so they could recover, but also to prevent them from spreading the disease as well. So that's a weekly community partner, is we look to troubleshoot those things, or like in the case of some of the community mental health providers, they had questions on, okay, how do they provide services and things of that sort? Should they wear a mask? Should their customers wear a mask? Those types of things. So it's actually been a really good experience from that standpoint. I think, as Kim indicated, Wayne County always does pull together, but it's certainly these weekly situational calls certainly exemplify that. Next slide. Okay, mitigation into early March. We worked with EMA on the provision of PPE to first responders, hospitals, and healthcare settings. We did not get a lot of PPE initially, unfortunately. So, it wasn't that tall of a task, to be quite honest with you. You probably heard on the news on the lack of PPE. Well, Wayne County was they were no different. We were no different in that regard. But certainly we got it out where we could. One of the other pieces that we do since our first case, which was in mid to late March, communicable disease contact tracing. And you heard me allude to this a little earlier when I spoke to some of the services we do, is COVID-19 is a class reportable disease. That was done in January by the Ohio Department of Health through the Director of Health. Basically what Class A reportable means is that you have to report it to the health department within 24 hours. We have communicable disease nurses that are trained in that communicable disease work, and they work with our hospitals, our healthcare providers, our nursing home facilities to not only obviously identify the folks that have been diagnosed with COVID-19, but also to find if they've had some close contacts to see if those folks need to be self-quarantined as well to protect the rest of the community. They are required to enter all their information into a disease reporting system that the State Department of Health maintains. And I got ahead of myself on that one bullet. So a big piece of that is following up with those known close contacts and having those folks self-quarantine. The other big piece, which was not normal health department business, was enforcing the stay-at-home order. Communicable disease contact tracing, we do that with other things. But the stay-at-home order admittedly, it was very challenging. First off, determining if a business was essential versus non-essential. I remember when this first came out, obviously there were a lot of businesses that were trying to, that obviously wanted to be essential because they wanted to continue to operate. That's certainly a natural thing that any business would want to do. So it's pretty tough to tell businesses they can't keep operating. It's something that you certainly don't want to do. But nonetheless, to protect our communities, the governor and the director of health felt it was necessary to come up with this criteria. And it wasn't out of the blue. Obviously, it was based on some national documents and things of that sort. The other piece, which is also equally as challenging, was enforcing the social distancing requirement. So say if you had a business who was essential, but they weren't abiding by the social distancing requirements, which really required you to have employees or customers 6 feet apart as much as possible, having hand sanitizer or some other way for folks to be able to wash their hands. And I'll get to that question. I see the chat question. I'll get to that. That's actually the next slide. So, but one of the things this has, I guess, a kind of a positive to enforcing the stay-at-home order is, and not that we haven't in the past, but we really work closely with local law enforcement to enforce some of these things. Kind of a last resort, and we've had to do it on a handful of occasions, is where I had to issue a letter to cease operations. These were businesses that were non-essential, that were trying to continue to operate for the most part. And then we actually had a social event that we had to issue a letter as well. So kind of the enforcement part is sometimes the ugly part of what we have to do. But again, it's really to protect Wayne County residents. And I know there's a lot to what's going to happen after May 1st, but I do believe that, obviously we've had to ask businesses and people to make some real sacrifices. I do believe that the stay-at-home order saved people from getting sick and saved lives. Go to the next slide, Kim. Actually, it's 2 slides of that question. I'll get to that. But in terms of recovery, and we're going to continue to do these mitigating activities. We're going to continue to do contact tracing. In fact, the contact tracing is probably going to last well into next year because I think what's going to happen is as start to relax some of the stay-at-home order, and also couple that with we're going to see some increase in testing capabilities, we're going to see spikes of people getting it even after, we start to open things up more. And we don't know what the stay-at-home order is going to look like come May 1, or if at all. I don't have any inside knowledge to that, other than I'm sure they're going to be relaxing it. Actually, today, not to do a plug for him, but the governor, if you've been watching on the Ohio channel, at 2 o'clock is supposed to announce his plan. And again, I don't have any inside information on what that's going to be, but I'm sure it'll be covered in the media. And or if you happen to be able to watch that at 2 o'clock today, might be, something to watch. Not that you want to watch it every day at 2 o'clock, but nonetheless, today will be an important day on what the state's going to look like post May 1. In terms of also with the recovery, we're going to continue to work with our community partners, providing the guidance, because it probably will change as we roll out. You heard me mention about the homeless and other types of congregate settings. We're concerned about where people congregate in terms of spreading a disease. Next slide. You asked about case counts, 104 right now and 21 deaths. And then today it was a headline in the Daily Record. Some people, well, do we have our stronger virus? And no, we don't. It's just kind of just how it's dispersed throughout the state. We've had a couple outbreaks at some nursing homes that have contributed to that higher death rate, so to speak. But nonetheless, if any of you have seen, the headline that was in the paper today, that's really what it's about. The testing is targeted, but the testing is targeted all over the state. So, well, I didn't see that part of the Daily Record. There was a chat that just popped up. Post May 1, again, I don't necessarily know what it's going to look like. If I had to guess, it'll probably be rolled back in phases. I don't think the whole state is going to be open May 1st as it was in January and February. But again, I don't have any inside knowledge or a crystal ball. I'm sure wearing masks in public will be a part of that, at least for a little while, not in perpetuity. Not sure what our role will be, and I should, when a vaccine comes, and I should say if a vaccine comes. I mean, there's nothing with absolute certainty that I've seen. But I'm kind of thinking about this in my career, like post H1N1, where the health department actually was kind of the lead when the vaccine first came out because of the limited quantities, where local health departments kind of served as the primary givers of the vaccine. So not sure if that's going to kind of be the same route if there is a viable vaccine that is developed, and you hear about 18 months, which quite honestly, that's really fast for a vaccine. Most vaccines take several years to develop, but I guess with folks working around the clock, maybe that can be shortened. And then I think the other thing that I would just like, the membership to know today is that life will change. I kind of likened it to post 9/11. Granted, we a lot of times at 9/11, we talk about how travel on an airplane has kind of been the big change that's kind of lasted. Again, I don't think we'll be having to wear face masks in perpetuity. But one of the things I can see happening is that the handshake will become less of a social requirement, less of a social necessity. It won't be quite the same as it was prior to that. There may be other things too. That's just kind of some of the things that I think we'll see. We'll see some differences even after all the rollbacks from the stay-at-home order, and where life is somewhat normal again, so to speak. I think some of those things will change. I think the handshake may be one of them. That requirement when you meet someone to shake their hand may not be there, and certainly may not be socially unacceptable not to handshake. So that's just my best guess on that one, but I do anticipate life will change. I think one of the things, and I kind of said this at the outset of my time today, was a really big thank you to the community. I think because a lot of folks did abide by the stay-at-home order, a lot of the collaborations that occurred in the community. And I would be remiss if I didn't mention the donations. A lot of donations of PPE, especially from local businesses who may have not, because of the stay-at-home order, did not need all the masks that they had, so they donated them to. And again, I don't want to steal Joe Villegas's thunder for next week, because he can talk about more of the nuts and bolts of how that worked. But a lot of the donations that came from those businesses went to our first responders. And but that, I think that's really, I think we can attribute, the flattening of the curve, not only to our community, but the community across Ohio, in terms of, there was a time when they were anticipating that our hospital systems, even with the things that we had in place, would be overrun. I mean, really, close to, 300, hospitalizations needed per day. And that's, that's something that's, our hospital systems in Wayne County couldn't handle that. Now it's actually been, the people that do the models for that and do the predictive models, it's about 1/10 of that, in terms of what they're predicting. And we're actually in the midst of the, at least I'm hopeful, we're in the midst of kind of the peaking, but we're going to plateau for a while for that before we start to see some downturn. But again, I do anticipate, as things are rolled back, that we'll see some spikes from week to week, from one week to the next. But nonetheless, Kim and Lynn, again, I want to thank you for having me today. I thank Rotary for having me today. I didn't know if there were some specific questions. I know there was one about cases. A significant anti-vaxxer population in Wayne County. We have some folks. I don't know that I would call it significant. Number of employees at Wayne County Health Department, we have 38 employees. About 32 when you put them into FTE. So we have some, some folks that are part-time. Big lessons learned to date. I have to say, I think that's a little soon to answer that question. And I don't want to come off as, braggadocious or anything, but we have a really, we were prepared for this. I mean, now some of the things and some of the nuances about the virus itself, maybe we haven't been quite prepared for. Which of the new professional relationships will continue even after this crisis? Well, I think, we've worked with our EMA before, but I think I think what I've seen is a lot of the relationships will be strengthened from that. Prior to that, especially those community folks, we've actually, a lot of the mental health, the social service, human service agencies, we've obviously have been working with those folks. But a closer relationship with our first responders, I think, is another one in terms of that question. Can I address the issue of testing shortages? I wish I could. But having said that, I do know that the state will be ramping up testing. So I think that will also contribute to, we'll see some of those spikes that I spoke of. Hopefully by the end of May, we'll have a significant amount of more testing. I certainly can't make any promises, but it looks to be that way. And then that contact tracing that I spoke to you about will become even more important, because if we do get like some spikes in cases, we will need to be able to continue to do that contact tracing, so that for those folks that are COVID-19 positive, we can identify their close contacts to have those folks self-quarantine as well. The masks on for Greg's question about conflicting information about the masks. So here's the thing. The N95 masks will help prevent you from getting the coronavirus, especially if it's fitted properly. A lot of times you can't just throw on an N95 mask. It needs to be fitted. The regular surgical masks, you're basically protecting everybody else. So if you were to have any kind of infectious disease, I shouldn't have touched my face. Don't do what I just did. You're not supposed to touch your face. But the surgical masks prevent others, and it's basically a polite thing. The fabric ones, the ones that are homemade, will kind of serve in that same capacity. I'll be honest, I don't know the efficacy of the cloth and the homemade masks, but I'm sure it helps to serve similarly to surgical masks that would prevent you from spreading a disease, but not necessarily protecting you from getting it. That would be the N95. How many I don't know the ages, but a vast majority of our deaths were nursing homes. And the State Department of Health licenses those. So that's supposed to be becoming a part of their reporting. But I can tell you a vast majority of those were nursing homes. I don't know about the ages, under the age of 80. I don't know that right off the top of my head, but, and then there was one.
Kim, can you hear me? Okay, I have one from an email that was sent.
Okay.
Has the health department given any direction to the Amish community as to when they can meet for churches and weddings? Some of them believe they can meet after the 1st of May.
Yeah, well, and actually, we don't know yet what the governor's going to say, and in all actuality, that would be true. If they don't do any, if the governor and the director let the order expire as it's written, that would be true. One of the things we've actually worked with Holmes County Health Department, and now we're going to be working with Ashland County Health Department to get that messaging out to the Amish community. So that's something we're working on. But yeah, I mean, but I suppose today is going to be the day where the governor releases some of that stuff where if they're going to keep part of that stay-at-home order, they're going to amend it again. So I don't know what that looks like. Again, I don't have I don't know what the governor's going to do yet. I don't have any advanced knowledge. So is that the only one you've seen, Lynn, on the email?
Yeah,
Does the health department have an effective number of personnel to devote to contact tracing? Today, yes, but I don't know what that'll look like, especially if testing ramps up the way that the state anticipates it. So we may utilize volunteers. I know the State Department of Health has recruited a large volunteer workforce of retired public health professionals. If we need to reassign some folks, we'll do that as well here. There's also potential funding, I'll believe it when I see it, to actually hire folks or to contract with folks to do this work. Brian's question about of the confirmed cases in Wayne County, how many have recovered? That's actually a difficult one for us to answer, and it's not because, it's mainly because of how our disease reporting system works. We typically don't follow them all the way through. We follow them when they're first confirmed, and then we follow any contacts that we have in terms of monitoring their temperatures for the people that are not COVID-19 positive, but they'll need to report to us. But we don't typically, because of the caseload, we don't typically do that, monitoring how many are recovered. So to that question. Is there any of those I missed? I'm just kind of looking back up at the. Any consideration given to the health consequences of the shutdown order? That's actually a good question about, there's a school of thought about not letting people get exposed to it then leads them to be exposed to it later down the road, especially in the absence of a good antiviral and a good vaccine. So that's actually a very good point. I think the big thing with a lot of the shutdown orders, really was about not overwhelming hospital systems as much as it was about saving lives too. But the reality of it is, and not to go too much into a history lesson, but if you look at the Spanish flu epidemic of 1918, St. Louis responded in a way, or I should say, much of the country today has responded the way that the city of St. Louis did, where they did do, they did do shutdown orders for a certain period of time. And then you had a city like Philadelphia who didn't shut anything down. They had parades, they had all kinds of celebrations. And many more people got sick and died in the city of Philadelphia and than they did in the city of St. Louis. So, and I don't know if you've heard the flatten the curve kind of a thing. So what happens when you do that is you flatten the curve. So yes, the spread lasts a little longer, but it's not with the same impact as if we did no kind of, what they're referred to is when they like the stay-at-home order and closing the schools and all of that. Those are referred to as non-pharmaceutical interventions. So that's what the whole flattening the curve is really about, is you don't want that big peaking bell curve that'll make many people sick and many people die, because our hospital systems all over the country, all over the world can't handle that. We didn't want to get into a situation like that happened in Italy, where they were basically, if they were a certain age, they were just left to die, So.
Okay, Lynn, do you have any more questions that came through?
No.
Okay.
Thank you.
Well, I took up way more of your time than I was supposed to. I
Hey,
apologize.
No, that's fine. This was good information. Thank you, Nick. Your timing's just fine.
Okay.
We aim to be done by 1, and I think we'll make it.
Yeah.
Are there any? Go
I
right
just
ahead.
want to say to anybody that has any questions after this, don't hesitate to shoot me a question. My email, it was on the last, I don't know if you could throw back up the last slide for everybody. I mean, it's my first initial last name and Cascarelli, and it's at wayne-health.org. Or you can call. I mean, you can call the health department and you can ask to be connected. I may not get, there's the number there too. Yep. Oh, flip it back. So yeah, I may not get back to you that day. I do have a personal where I try to get back within 24 hours. So that's kind of my personal guideline. So, and as you can imagine, within the midst of what we're in now, I, definitely not always able to get back to you that day, but I certainly will give it a try. So if you have any questions later today you thought about, you're like, man, I wish I would have asked him, go ahead and ask me.
Okay, Nick, thank you so much for making time. I can't imagine that you have a lot of spare time these days. So we really appreciate you joining us for the information you were able to share for our inaugural Wooster Rotary Zoom meeting. Dennis, I'm sorry, your question exceeds my technical capabilities. I can't help you with that one. Let's see. The only announcement I have right now is to confirm our speaker for next Monday, as you heard, is Joe Villegas, the director of the Wayne County Emergency Management Agency. So more to come on the county response and approach and impact of this COVID-19 pandemic.
Kim, we may want to thank the folks that have been calling our subscribers for Pray to Flags, and just remind everybody, if they haven't subscribed, it's a good time to do it right after this meeting.
Absolutely. You heard her. Thank you. Thank you. If you go to the Rotary, our Wooster Rotary website, there is a link right there front and center to take you to the site to place an order, renew your subscription if you have not yet renewed your flag order. And we have every intention of getting those numbers back up again this year. The calls were, Marty mentioned to me, Marty, I forget, what'd you say? How many calls? 500? Oh, you're muted. I'm sorry.
I'm sorry, just under 500. And
Okay.
we're almost done.
Fantastic. Yes, thank you all. Let's see here. I think for now, if you have questions, like Nick said, his email address was shared. I can share it. We can get that to you also if you're not able to find it. Questions about Rotary and our activities and events, you're welcome to contact any of us on the board. And we will just move through these next several weeks and possibly who knows, another month or 2 or 3, we don't know where we'll be in terms of being able to gather in large groups like our club size. So as long as we need to continue meeting in this way, we'll try to do that so that we can get re-engaged. I felt really out of touch with all of you the last 5 or 6 weeks, so I thank you for coming online here with us today. And I will say, as we go through this final week of the month, the last week of April, which has felt like the longest year ever, it seems duly appropriate that we focus on that final question of our 4-way test, which is, will it be beneficial to all concerned? And with that, folks, we stand adjourned. Thank you all.